New videos every day. Psychiatry. Life, wisdom.
Well, right now in the field of mental health, the options are, honestly quite limited.
Right.
But the education that's out there, I think, can go a long way towards helping people.
I'm Psychiatry correspondent Karina Rachel. Thank you for tuning in to The Truth Talks. I'm joined today by Sean Blackwell, founder of the YouTube channel Bipolar or Waking Up. In this video, we're going to talk about different options in mental health so that you know all of the options available to you or anyone in your family should you have undesired emotions or behaviors that could end you up with a mental health diagnosis. Sean, thank you so much for being here.
Thanks for having me.
So clearly we can all agree that we experience different emotions, different behaviors in our lives.
Mm-hmm.
And there are certain emotions and behaviors which are undesirable.
Mm-hmm.
And clearly we could think about depression, having suicidal thoughts, extreme anxiety, etc.
Mm-hmm.
And for each of these different emotions or behaviors, there is a mental health diagnosis or a mental disorder, a diagnosis that would be easily given to the person presenting those emotions or behaviors.
Mm-hmm.
And what we've discussed in our previous videos is that maybe going down the route of receiving a mental health diagnosis and taking psychiatric medications is maybe not our only option. So can you maybe talk about what other options are there in the field of mental health?
Well, right now in the field of mental health, the options are, honestly quite limited.
Right.
But the education that's out there, I think, can go a long way towards helping people, particularly with what I would call sort of mild to moderate disturbances that they're going through.
Right.
Okay. And I'll give you an example of what I mean. In one of Stan Grof's books, he talks about the difference between a spiritual emergency, which could be a real emergency that looks like a psychosis and would be very difficult for anybody without any education to manage. Okay.
Mm-hmm.
They can be managed, but you really kind of have to have some experience with it. And I'm happy to work with people with spiritual emergency. But there's this thing he calls spiritual emergence, which is like a process. It could be very uncomfortable. You're taking in a lot of new information. You're feeling anxiety, but you can manage it, And I think that we just need to create more space in our culture through the awareness of knowing that people can have non-ordinary or anomalous states of consciousness that don't necessarily fit with our regular reality, and that they can be therapeutic and beneficial, and that we don't have to hit the panic button.
Right.
Okay. Right. And to give you an example, last month I was in Eastern Europe working with a girl, and we talked about her symptoms, and I said, so why were you hospitalized the first time? And, she was making some bad business decisions, and she was getting angry and feisty with her parents, and she wasn't herself, okay? And she was very talkative, so she was giving hypomanic symptoms. Mm-hmm. But hypomanic symptoms are something that, you can, for the most part, allow to happen in the house. This girl had been hospitalized 7 times for symptoms that, in my mind, were quite mild. She never got delusional. Only in episode 5 and 6, I think she got delusional. She never had hallucinations. She never had paranoia. But would go into sort of these hypomanic states, and then they would just ship her to the hospital, which further traumatized her.
Right.
So it really didn't help. And she gained over 80 pounds from the medications that she was on. Wow. So we're talking about a girl, skinnier than you, really, like a really rail thin girl who all of a sudden just blew up. And, especially for women, the self-esteem issues related to that.
Right.
And she went on to lose 5 jobs, in consecutive because of the disorder.
And this was after she had commenced treatment. After
Yes.
she's already under the care of a psychiatrist, taking these medications, she proceeded to gain all this weight, lose 5 different jobs.
Yeah.
Was she happier?
No, she was miserable. And, I live in Brazil. and she paid me to fly to see her in Eastern Europe because she couldn't get a professional to help her. You know,
Wow.
that says a lot,
Mm-hmm.
I think. And then she was a person who was just really determined, you know, to get off her medications. We had a very successful 3 weeks together. You know, it is a deeper, you know, it's not a mild disorder. Bipolar disorder is something you need to take seriously. And it might take another session or a few more sessions for her to work through things completely. But she left our work very satisfied, completely unmedicated, and sleeping like a rock, and really doing very well. So I was quite happy about that.
Right. Yeah. And I think that you bring up an important point, which is that at some point in our lives, sometimes the emotions kind of reach a point where, as you kind of said, we might hit the panic button. So, oftentimes, the entire kind of approach of psychiatry, which has been to say, okay, well, you can have mood swings, but if they're this severe or this, then it's abnormal. And you can be depressed, but if you're depressed for this long, or you're this depressed, then, suddenly it's abnormal. And it's kind of imposed on us this, these kind of barriers of what's normal and what's not normal. And, I think what's interesting is that each of us as a person can observe that we experience all of these different emotions, and who are all of these psychiatrists to come in and say, oh, well, this one isn't normal, or you've just experienced too much and now it's not normal anymore. Mm-hmm. So I think this approach of saying, you know what, maybe these emotions and these feelings you're having don't mean that you're abnormal. They mean that you're normal, and that there's something in your life that you need to get through, or there's something in your past. We talked in a previous video about the traumas from our past and how those can kind of come up and manifest as, anxiety or depression or these different feelings that could end somebody up in a mental hospital. And I think the other thing you mentioned that's very true is that the experience of being institutionalized in a mental hospital is itself incredibly traumatic. And so what is being prescribed as the treatment for these emotional problems that people might experience is this really traumatic experience where you go on psychotropic drugs that in themselves have a whole slew of negative side effects and potential dangers associated with them.
And I think, as a whole, we've just got to get more accustomed to people being in anomalous or non-ordinary states experiences. It's just like, oh, he's not himself today, and just sort of support that and be sensitive to what people are going through. We're sort of in an epidemic of it now. It's becoming quite common. I'm sure probably every person watching this video knows somebody who's been labeled with bipolar disorder. When I was in high school, back in the 80s, I didn't know anybody who had manic depression or bipolar disorder. Right? Now it's like, oh, he's got it. We're in an epidemic of mental disorders. There's no doubt about it.
Right.
And it's just, we've got to get more comfortable at supporting people emotionally in non-ordinary states.
Right. And I think, because it's interesting, and this issue of prevalence of mental disorders has been discussed in a lot of different avenues. There was an article in the Scientific American where they were looking at this particular issue, and they actually said, well, there's probably some combined factors here. One of them being that, now doctors know more about it. They actually have pharmaceutical drug representatives and people who come to them to educate them about it. And, there's also now a financial incentive to prescribe more medications. That probably plays a role too. So it's not necessarily that everybody's just more mentally ill, but that there's these other factors and why there's so many more diagnoses of these different mental disorders.
I think, medications control symptoms in the short term. And that is something that in certain situations, especially the way the world is today, people can find beneficial in the short term. But in the long term, they just seem to make people's lives worse. And, and on a theoretical level, if you do the research, you'll see that psychiatry and Big Pharma know nothing about the origins of these disorders. They know absolutely nothing.
Right.
And so my big criticism regarding psychiatry isn't necessarily that they've created these drugs, but that they keep telling people that they know what they're doing, when in truth, they really don't know what they're doing.
And I think also that they've created these drugs and then they just use the drugs as the treatment. So
that's the
in
treatment.
place of true human compassion, to really work with someone, try to get to the bottom of what they're feeling and help them feel supported, that now the treatment modality is you're dysfunctional, you have a disorder in your brain, there's nothing you can do about it, here's these medications, hope they help. And so it's not necessarily that, I mean, clearly the medications themselves, they have unwanted side effects. In some cases, the side effects of the drug are diagnostic criteria for other mental illnesses. Not to mention the toxicity on your liver, the other health effects. But just aside from looking at that, I think the dependence on those drugs to be the primary part of the treatment is what's problematic. And so where the drugs could be useful in a situation where you had a psychiatrist or doctor who really was supporting the person, treating them with compassion, really kind of knew what they were going through and could use the prescription drugs, in a very specific way. And as you mentioned, on a short-term basis.
Yeah, almost a surgical way, like just for that moment in time.
Rather than just this dependence on treatment. And most of the people who have received a mental health diagnosis will tell you that they're told this is something you're going to be on for the rest of your life. This will never go away. There's no hope of healing or recovery. I can't remember exactly which article it was, but there was an article, and there was a psychiatrist who was asked, what is the rate of recovery from mental illness? And he literally said, we don't really talk about recovery in the field of mental health.
Yeah.
And so as a person, you go, wait, what do you mean you don't talk about recovery? And so it's a very kind of glib existence to be given that, okay, well, now there's nothing you can do about this. Your brain is dysfunctional. You have to depend on these drugs for the rest of your life. That in and of itself is the problem, not necessarily the drugs themselves, but kind of the impersonal use of those drugs. The relationship that most people have with their psychiatrist is impersonal. And maybe they don't feel understood, or maybe they don't even feel like the psychiatrist listens to them at all. And I think when we're talking about our emotions and our feelings, what you really need more than anything is somebody who's going to be able to help talk to you about your feelings and about your emotions, and not kind of, see that as a area that they don't really want to touch on. It's not really their field, which is the impression that I've gotten from a lot of psychiatrists that I've spoken to. So can you maybe talk a little bit, we did a whole video talking about healing techniques, and you talked about some of the different techniques that you've used to help people get through these emotional states, what you kind of described as, I can't remember your exact wording, but this emotional state that's kind of what we wouldn't think of as normal, what we think
like
of
a non-ordinary
as
state of
non-ordinary state of consciousness.
Okay. Okay, well, yeah, so really you're asking me about support, like how can you support? And there's one very interesting term. It came from, I believe the original person to come up with this idea was Dr. Lauren Mosher, with what was the Soteria House Clinic in the late 70s and early 80s in San Francisco. And that clinic was open for 12 years. It was government funded. And they took care of people in acute psychosis, so what was considered really the most serious of mental disorders. And what they did was they didn't hire psychiatrists or psychologists to work there. They had a head psychologist, but that was it. And Lauren Mosher was the former director of the National Institute of Mental Health Division of Schizophrenia. Okay, so he was a big player at the time. And what they found was that the best results they received were with people supporting people in non-ordinary states who were tremendously empathetic. College undergraduates who were completely untrained in psychology, they were in other areas of study, but were very empathetic. proved to have better results in the Soteria House environment than trained psychologists or psychiatrists, people who have received their PhDs.
Right.
And the reason was that in moments of stress between the person in crisis and the supporter, the professional, the PhD, would put themselves above the person in crisis. Whereas the undergraduate was more likely to remain humble in their connection with the person in crisis. Now, this is an extreme situation, but it shows how important empathy is, especially when people are in non-ordinary states. Okay, but I would say for people out there who are seeing their family members going through something strange, okay, that you don't need to know how the watch works to tell what time it is. Okay, you don't need to know what's going on exactly, and that's everybody wants to know the answer. What's going on? What's the reason? What's the reason behind this?
Right.
But if you could just support that person with a low stimulus environment, keep things kind of quiet around the house. Don't challenge the person who's going through whatever it is that they're going through, and just be with them as much as you can. Hold their hand. Do what they want to do. If it seems a little crazy, go ahead. If it seems dangerous, don't do it.
Right.
I was working with one guy, again, extreme state. And my wife and I were supporting him. And he had taken all his clothes off, which was fine, okay, because I've worked with people like that. I took my clothes off in my acute psychosis. When you have an ego collapse, you lose your sense of shame. So that's one of the things that happens. And then he looked at me and he said, "Sean, could you and Leisha please take your clothes off?" And I said, "Oh, man, I'm not really comfortable with that." And he just said, "Okay." Off we went, and we continued our day together, and had quite a powerful healing process. But, just this ability to relax in the face of strange behavior, provided that they're not violent,
Right.
and they're not hurting themselves or other people, and that if you're being empathetic with them, that they're remaining cooperative. I would pay attention for paranoia, because most people who are untrained would really have a hard time dealing with someone in a paranoid state, and there's not much you can do there. But there's such a range of difficult experiences like panic attack or depression, or even manic episodes that you can just sort of support as best you can, as opposed to snapping on it, jumping on it right away and taking them to the psychiatric hospital, like is what's happened with this girl I talked about. 7 episodes, and I'd say, "Well, what were the symptoms?" And I was getting argumentative with them. Off to the psychiatric hospital they went. It's just too fast. You got to give people some space, some empathy.
And I observed that with my mom when she went through her bipolar, what she ended up being diagnosed by bipolar 4, and her only diagnostic criteria was racing thoughts, was talking too much. Very benign. She was talking about her childhood. No violence, no harm to anybody, nothing like that. And what my kind of instinct, if somebody is talking a lot, having these racing thoughts, would be like, wow, they really need to get something off their chest. Well, when my dad took her to the mental hospital, they gave her a major tranquilizer to shut her up. Immediately, when you walk into one of these mental institutions, you get the feeling that this is not a warm, compassionate place. This is not a place where the people are kind to you. I actually interviewed on the channel one of my friends who, in his college years, had actually worked as a tech in a mental health hospital. So he just, worked in there. He was, in college or whatever, and was working in there. And he shared in in his videos that, he was told to restrain people if needed. You would have no problem, holding someone down, restraining them. If they're talking too much, you got to give them something to make them can it. There's no need to treat them with compassion or really be nice to them. And he observed among the other people working there that was just kind of the status quo, that the patients were seen as, almost subhuman. And so you could almost treat them disrespectfully, certainly not warm and compassionately.
That's how I was treated.
Right.
Yeah.
And I think a lot of people have that experience
Uh-huh.
in a mental institution, and it just immediately kind of strikes a chord with me, because I'm thinking, wow, if somebody is in an extreme state of mind, they're extremely emotional. Oftentimes there's fear or anxiety associated with that. The last thing you would want to do is be cold and harsh to them. That you would maybe be warm to them, help them feel safe, help ensure that they're okay, that nothing is going to happen to them or something like that. But really this warmth or this compassion or even just this humanity is kind of completely ignored in the mainstream mental health treatment facilities anyways.
So I think there's a real future in training simply families to do this kind of work. And I personally, like my wife and I are hoping to get a clinic going near or not a clinic, a healing center, I'd prefer to call it, in the back end of 2014. And, we're going to work with minimal or no staff. And what we're going to do is have people come to us and bring a family member or a friend who is supportive of what's going on. And we're going to ask for total family support for what we're doing. Then we're going to train, we're going to work people through a healing process, but also train the family member on how to deal with non-ordinary states when they go back home if they arise, and possibly even how to, work as almost like the therapist in helping that person work through more difficult material, So that's our plan.
That sounds excellent.
Yeah, because the idea of sort of opening a bigger place with a bunch of professionals and having many people going through difficulties at the same time, people interfere with each other. You got 3 people in psychosis in the same room. That's just a nightmare. You just can't deal with it. You need a low stimulus environment, a lot of personal attention on one person who's going through something which could be very special, sometimes.
And when you mention that, that is very true of what I saw actually going and visiting my mom in the mental institution. Is here's all of these people, some of them in very extreme states of mind, but there were probably 20 different people of all these patients all in this same room, significantly outnumbering the number of nurses or staff or anything like that. There's one psychiatrist that treats them all, sees each one of them for 5 to 10 minutes every couple of days. And so to contrast this very kind of cold, impersonal environment with something that's, warm and supportive and loving, just I think really gives me a lot of hope that there can be alternatives to conventional mental health treatment that really can help people and really can give people another option. Because at the very least, we should have the option of choosing, do we want to go the route of traditional mental health and take medications, or do we want to look at an alternative route? Minimally, we should have the choice to decide.
You can have the choice, and you know what I think is probably going to happen? Because of the world that we're in right now, you're going to have a situation where people are using psychiatric medications, and I'm talking about more severe stuff like bipolar disorder and schizophrenia, as a tool to get them, okay, I need this until I can get into a therapeutic process that's really going to help me, and then work to get off the meds. And there's one piece of research I was just looking at before we started talking by a guy named Wunderlink in the Netherlands. And what they did was they had 2 control groups. No, not 2 control groups, the test group and the control group. And they had one group that remained medicated, and the other group, they took off medication after 6 months. So they had an acute psychosis, and then they took them off the medication after 6 months. Now, for the first 2 years, the number of relapses in the group where they took them off medications was higher than in the control group. But then they continued. They continued taking them off meds. Every single time they relapsed, they'd give them meds, but then take them off. Give them meds, and then take them off. And after 7 years, what they found was that the recovery rate was double for the people who were taken off their medications after every relapse. 40% of people who were diagnosed with schizophrenia or schizophrenia-related mental disorders recovered completely after 7 years. Wow. At the 7-year mark. And that recovery rate was like 17% as opposed to 40% in the group that remained medicated.
Wow.
Yeah.
And I think that that's very interesting. You said at the beginning of this video that, medications can be used to ameliorate or to handle symptoms on a short-term basis. And I think the same could be said for just about any drug. You have a drug for heart disease or a drug for this, optimally using it to suppress the symptoms for a short term is going to be optimal. But then this idea of a lifelong dependence on a medication, whether it's mental health related, psychotropic medication, or any other kind of medication. The idea of recovery, of healing that we get from this, just being open to the idea that we don't have to depend on medications our whole life, that this is something that we can move through and actually heal from, and as you've mentioned in your videos, actually end up in a better place than we were before the whole thing began.
And maybe I'll just finish off with just one example, a hypothetical example. If I had a daughter who was in a manic episode, I wouldn't take her to a psychiatrist. I would keep her at home, low stimulus environment, give her some crayons and paper to work with, and maybe ask her to talk about her feelings, really connect, and be very supportive. But if that manic episode happened in another country, she's away from me in another country, and she needs to fly home. If you go manic on an international flight, that can be a major incident, very dangerous. Okay?
Right.
So obviously, medications are absolutely required in a situation like that.
Right.
See.
Right.
But then, once I would get her home, I would take her off the meds again and do exactly what I would intend to do if she was with me the first time.
Right. Well, Sean, thank you so much for being here. This has been a wonderful conversation.
Thanks for having me.
Thank you so much for watching. I do hope that you liked this video. Please leave your comment and let us know your thoughts after watching. What do you think could be an alternative to conventional mental health treatment? Or do you think that the conventional mental health treatment is just fine the way it is? Please be sure to subscribe to our channel. You can also subscribe to Sean's channel. And we look forward to seeing you again soon. Thank you so much for watching.